My doctoral capstone experience was virtually completed at RefugeeOne due to the COVID-19 pandemic. Refugees are defined as people who are seeking refuge from their home country due to violence or being persecuted for their race, religion, or political viewpoint. RefugeeOne is a resettlement agency in Chicago that works with refugees to assist with resettlement and provide services for this population. More specifically, the wellness program at RefugeeOne aims to serve clients with functioning, mental, and physical health needs, including housing, vocational training, employment opportunities, English language training, and women and youth services for children ages 0 to 3. There are no occupational therapists on the team at RefugeeOne, so I had to do a lot of kind of like self-guided learning and exploration with the role of occupational therapy within the refugee population. Refugees experience prolonged exposure to traumas as well as decreased resources and services. On average, refugees spend 17 years in exile, while some spend up to 30 years as a refugee. They also experience decreased access to food and shelter, proper sanitation, job opportunities, decreased access to healthcare, support services, increased risk of poverty, decreased educational opportunities, and racism in the home country. This structural restriction of occupational engagement due to uncontrollable external factors is defined as occupational deprivation. One study found that only 19% of women refugees received a pap smear and only 10% received a mammogram. Other health disparities include refugees having a higher risk of high blood pressure, diabetes, arthritis, oral diseases, and mental health conditions. Refugees are more susceptible to mental and physical health risks due to COVID-19 based on research from a recent research study. Ultimately, virtual occupational therapy services can mitigate the health disparities and occupational deprivation experienced in general and especially during COVID-19. My conceptual framework for the doctoral capstone experience was the person, environment, occupational performance model. So I really had to do a lot of exploration and learning about each individual client, since everyone has a unique culture and a unique language that they speak, as well as different ways that they cope with stress. So that posed a lot of differences when it came to cognitive, spiritual, psychological, and physiological factors of the person. Trauma can impact memory, learning, and concentration. So there was a lot of memory reinforcement I had to do with different educational strategies that I gave, as well as some task simplification. I also had a patient who had more of a somatic or physiological reaction to some of the different anxieties that she was experiencing when it came to financial hardship or her child's development, and that took up a lot of clinical time. So by kind of assessing the person's needs, I was able to look at the environment and discover ways that I could modify the environment by either making it more simple or taking away some different barriers, whether that be structural barriers, technological barriers, cultural barriers, or financial barriers, so that I could foster the client's independence and promote occupation and performance. Although there are numerous services that are available to members at RefugeeOne, there are no occupational therapy services. Additionally, new barriers like COVID-19 further separate refugees from the equitable care that they should be receiving. Therefore, my research question is, how can occupational therapy address the well-being and health literacy needs of refugees during COVID-19? I had a mixed methods design, so it was mostly qualitative data that I used, but also some quantitative. I conducted and facilitated 4 focus groups with colleagues over Zoom about the perception of the role of occupational therapy within the refugee population and growth opportunities for occupational therapy within RefugeeOne. I also measured the efficacy of my Capstone project interventions through subjective ratings and reports by my clients, whether that be just OT interventions or the perception of the telehealth platform as well. So for my focus groups, there were 4 of them, and they were 30 to 45 minutes each, with 7, 4, 2, and then 3 colleagues at a time. Colleagues' job descriptions consisted of managers within the RefugeeOne wellness program, interpreters, home visitors, and interns. Many of the colleagues had been or are refugees, so they were able to give that kind of well-rounded perspective and that participatory perspective of like the refugee population. So the focus groups were recorded and transcribed verbatim, and a phenomenological approach was used to pull out different emergent themes to kind of like figure out the themes for the different focus groups and what to take out of this experience. And then I also surveyed clients over the phone and ran descriptive statistics on scores using a Likert type scale, as well as asked open-ended questions and summarized the answers provided. The results of the focus group themes were that refugees experience occupational deprivation was the first theme, and the quote that defines this theme was, "I think this is huge for refugees who are already needing to adapt or feeling maybe out of place. This will be one hurdle that they don't have to jump over." And that was in reference to having universal screening for developmental delays for the pediatric population. They currently have no screening for developmental delays at RefugeeOne. Another quote that defined that theme was, "For a lot of the adult clients, there are a lot of concerns around, because of the trauma they've experienced, there are a lot of issues around learning, and that affects their ability to adapt in a new environment. Their memory can be affected, concentration and focus can be impacted, so basic skills needed to adjust to life in Chicago can become that much more difficult." The second theme was that occupational therapy is holistic in nature. So as we kind of progressed throughout the focus groups, we discovered that colleagues at RefugeeOne learned a lot about OT, and it shifted from just having a medicalized physical focus to more of a holistic understanding of occupational therapy. So one of the defining quotes was, "I was just thinking about what the other participants said with sensory techniques, and having clients who've experienced that trauma, I've just been thinking as a therapist how much sensory work really grounds and helps to regulate people who have dealt with trauma. So I mean, that could be used as a great synergy as well, being able to add those things that as clinicians we haven't thought about." The third theme was, "Having occupational therapy at RefugeeOne can mitigate structural gaps in care." The defining quote for that was, "Because many of our clients experience difficulties with adjusting, it leads to difficulties in their daily life. And we're thinking about having people rebuild their life. They need to be able to function within their daily life and have meaning. So when you explain that to me, it coincides so well with occupational therapy. Of course, you mentioned funding, which is always an issue, but I would love to have somebody who is an OT at RefugeeOne, especially if we move into more of a healthcare setting now that we're opening the dental clinic, and if we had a physical health doctor and an occupational therapist that could support with that piece too, that would be ideal." And then the fourth theme was implications for future occupational therapy practitioners at RefugeeOne. The defining quote for that was, "I think someone who's open, who's flexible, open to learning new things about new cultures, maybe role changing as needs come up, this is something that happens a lot at RefugeeOne and would be really beneficial." Another quote was, "Yeah, I think it seems there are a lot of different areas where their occupational therapist work can be used. I think it would be cool to see a partnership with work with young kids." And then finally, "I think primary care could be a really helpful relationship because we have a great connection with Antilles Clinic here." And then the results of the efficacy of interventions. There was a quantitative measures, which were using a Likert type scale from 1 to 5, 1 being poor and 5 being an excellent rating, concerning satisfaction with the telehealth format, as well as the perceptions of the quality of care provided. And then the mean rating for the satisfaction with the telehealth format was a rating of 5 out of a maximum of 5. And then the perception of the quality of care during the last 3 to 4 months with the virtual services was a mean score of 4.88 out of 5. And then for the brief answers to the open-ended questions about health literacy skills and progress towards health goals. First, with the health literacy skills, the summarized response was that clients experience increased self-efficacy with hospital navigation and managing different health processes like dealing with insurance coverage, referrals, becoming familiar with the green card process, as well as some clients were able to verbalize strategies to promote healthy child development or strategies to stay safe during COVID-19. And then the summary of the progress towards health goals include gaining pre-vocational skills, successfully keeping older family members safe during COVID-19, reported decrease in pain after practicing their active range of motion home exercise program, increasing ADL independence, successfully reimbursing for personal assistant hours for financial reimbursement, and then for the pediatric client and her caregiver, increasing independence with toileting, decreased picky eating, decreased use of the pacifier or bottle for the 2-year-old, given the CDC recommended guidelines for that. And then generally for occupational therapy, one client said, "Everything that we discussed was extremely helpful. She doesn't use the pacifier anymore." Another client said, "You teach me exercises. It used to be difficult to go to the bathroom, but now I have the strength to easily move around my house. You couldn't believe how much pain I had in the beginning. I used to have someone help me to the bathroom. Now I do it by myself." And then just general discussion about the experiences of the doctoral capstone experience. Occupational therapy does have the capacity to increase health, well-being, and occupational participation within the refugee population, given the findings of the experience. There was an overall highly positive response from colleagues and clients, and the colleagues and managers at RefugeeOne reported looking forward to maintaining a contract with the occupational therapy doctoral students, and even hope to eventually expand the wellness program to incorporate occupational therapy services for adults and for children, with the emphasis on like primary care and health management and developmental screening. Practice implications for occupational therapy. What I took from this doctoral capstone experience was that occupational therapy's role in working with refugees seems feasible and beneficial per response from RefugeeOne and the clients. Although there does need to be continued research on exploring refugees' experience of occupational deprivation and breaking down the structural barriers, closing gaps in care, mitigating health disparities, and increasing independence during the acculturation process. And then there's a continued need to explore occupational therapy's role with refugee advocacy, teaching health literacy skills and self-advocacy skills. Again, reflecting on that need to break down those systemic barriers to their care. And then finally, there's a continued need to explore occupational therapy's role with refugees in meeting primary care needs and pediatric developmental needs. There is a reported need, and it seems like best interest or best fit for future students to have an interest in either pediatrics or primary care, given that the pediatric population needs universal screening, as that's not in place right now, and there's a high need to address different learning, health literacy skills, disruption in routine with the adult population. What I learned throughout this experience was that I was constantly learning, whether that be what the role of an occupational therapist is with the RefugeeOne population, as well as how to be culturally competent. There's this constant feedback loop through my mentors, through the interpreters, and people who are immersed in my client's culture, who are able to kind of guide me what exactly was of value to this client, what was culturally appropriate, things like that to help me really have a good understanding of holistic client-centered care. And then there's also, I learned the importance of being flexible and open-minded, accepting that I don't need to know everything, but it's enough to just be really, really open to constructive feedback, as well as like being flexible during COVID-19, and just like learning as I went, and being kind of culturally, like have that cultural humility, and just being willing to learn about different people and their backgrounds. There was also, I learned the benefits of great mentorship and receiving constructive feedback when working with diverse populations. This is something that I really value now and am going to look for when I apply for jobs. And then challenging yourself can be rewarding. So just being confident that you gain those skills that are necessary to be an independent occupational therapy practitioner. And just by like jumping at different opportunities and exploring new avenues can be really rewarding. And I got a lot of positive feedback from clients and managers about exploring this client-centered care and just being confident in administering that. These are my references. Thank you so much for listening to my presentation about my doctoral capstone experience.